Hello, my name is Dr. Ho Shufin. I'm the consultant ophthalmologist and oculoplastic surgeon, currently practicing as a sessional basis in KPJ Ipoh. Today, I would like to talk with you about oculoplastic surgery. What exactly is oculoplastic surgery? Basically, it's a plastic surgery around the eye, which is like this. Some people say that it's just a cosmetic operation and it only benefits people who want to look beautiful. Well, cosmetic surgery is just part of the oculoplastic surgery, and it's just a small part. An oculoplastic condition can actually affect a lot of people, whether you are young, newborn, middle-aged, or elderly people. So now let me bring you through what is oculoplastic surgery. So as mentioned before, oculoplastic surgery is a pathology around the eye area. This is actually affect the eyelid, whether the brow, the eyelid. It can be because of trauma or infections. The second part is about the drainage of the tears, which goes to the nose. The third part is the orbit, which is the tissue around the eye area. And some people who lost the eye, we also perform the socket surgery. And some people with abnormal eye movement, we can also treat them. And lastly, of course, is what we're talking about, cosmetic operations. Now let's look at the eyelids pathologies. The most common one we've seen is the droopy eyelids, what we call the ptosis. As you can see, it happening in the elderly people, middle-aged, and in the young boy. And as you can see in the droopy eyelid, in the elderly people, you can actually cover the corner of the eye. I always have patients coming to me saying that when he drives, he had to lift the eyelid up, or when he's trying to read, he's not able to read because the eye has drooped down. And in fact, when I was in UK, I performed an award-winning study with my consultant about the visual field defect. We noted that people who had droopy eyelid actually cannot see better. And with doing the operation, they actually can improve the quality of the vision. So as clearly seen in this patient, before the operation and after the operation, and before and after, and the benefits of it, I can even do the double eyelids on top of it. And this patient had more severe, and I have to do a more drastic operation, which is taking the time. But otherwise, most of the time, the operation can be done under local anesthesia as day-care basis. And as you can see, the operation is quite easy, finished within 1 or 2 hours, and can go home at the same day. And for children, it's even more important to do this operation. The reason is when the eye has first 7 years to develop. During the development, if the eye has become droopy, the eye will stop receive the image, and then there will not be any connection formed between the eye and the brain. So the child will develop what we call the lazy eye, which means that the eye looks normal, eye structure is normal, but the child cannot see. And therefore, it's even more important for us to intervene in these circumstances. As you can see, because the muscle is not developed, and as you can see, is the operation done under general anesthesia, and usually the patient can go home the same day, and we can see the result is quite satisfactory. Okay, now the next one I'm going to talk about is the lumps in the eye. While most of the lump along the eyelid is benign, some of them can be sinister or nasty. Like for example, in this patient, she presented with a lump which was operated 4 times before, but it's still present. And on inversion, you can see that actually there was a sort of like lesion there with a lot of vessel, and then the border is irregular. This is classical pictures of a cancer. Okay, and the patient, after I remove it, there was a big gap there, so I form a reconstructions to make the eye looks better and normal. Okay, the next one I'm going to talk about is the watery eye. And it is actually quite annoying problems, and also quite a lot of embarrassment. So, and it can be quite dangerous. Imagine you are driving and then the eyes become watery. And There are several causes for the watery eye. The first one is the hypersecretion because of irritation from the eyelashes. And as we can see, the eyelashes that go in. This is commonly happening in our population because of the East Asian group. And it can happen in a child and it can happen in adult when they put on some weight. And as you can see, by doing a simple procedure under daycare setting, the lashes can bring out the eye feel more comfortable and actually become much bigger and attractive. And again, the same thing can happen in the elderly people because of the lid laxity, which you can see here. The eyelash has rolled in. So what we can do is again perform a simple procedure with less than 1 hour under daycare and the longer anesthesia, and the patient can go home the same day and the eye no longer uncomfortable and become watery.